now sort of the changing profiles of people as they age. So I was just wondering, in that context of cost pressures and new ways of treating these longer, more complex episodes of care, it just struck me that, what you're talking about, practitioner nurses and OTs might be able to assist, one, provide better care to the most vulnerable, but also perhaps take some cost pressures off that maybe GPs aren't the only solution.
I think one of the things that we referred to in our submission was about the need to have a multidisciplinary case review or some kind of discussion following the assessment. So at present, there's only funding available for actually going and doing the individual work with the consumer. But we would think, and I think the nurses would agree, that having some capacity and potentially some funding to have a multidisciplinary discussion and to improve that communication and to make sure that there's not duplication of roles and that that the money is being spent efficiently to us would make good sense. So that we'd have some, there'd be some time built in to have that discussion with the other allied health providers and any other health providers that are engaged in the care of the consumer. And I think, with the shift to, I guess, more allied health providers being used through Medicare, I guess the traditional model would have been that all of those allied health providers might have worked at a community health facility or been in the same public funded facility. So I've certainly noticed in my past 15 years of practice that people are a lot more isolated in their practice, and I suppose when you're a private practitioner, that isolation is quite pronounced. So having the opportunity to have that communication and to get some compensation for that, we would certainly be interested in talking about.
Thank you.
And if I could add to that quickly, I guess in terms of a multidisciplinary team is going to be quite powerful, getting the right people with the right qualifications and skills. We do have an issue that we alluded to in the submission about making sure that people understand the different contributions that health professionals can make. And from an occupational therapy perspective, we know, for example, that in mental health, we have some of our members saying that GPs don't necessarily understand the specific contribution that occupational therapists can make, and they might be sending referrals to places where it often ends up at the OT at the end of the day. So that would be something that could be improved.